Now for the next artery which we are going to discuss, its anatomy. This is what is known as the internal thoracic artery. Internal thoracic artery. So for the internal thoracic artery, see, it's an artery way so up here, and it's actually a branch from the subclavian artery. Can you pinpoint it out? Alright, so you said that the internal thoracic artery is also known as an internal mammary artery. Mammary, why? Because it lies under the breast. If they are going to bring a proper picture where you see this is a rib cage, right? So if I see the very good picture with the muscles and tissues, the breast should be on top of it. Do you understand? So it's very important when you are doing breast surgeries, like breast cancers, all those liposuction. I have to be very careful about this artery. So it's a paired vessel arising from the subclavian artery. It descends along the internal wall of the thorax, just lateral to the sternum, and it supplies the anterior chest wall. It supplies the breast and the diaphragm. So what's the anatomy of the internal thoracic artery? Okay, arising from the first part of the subclavian artery, descends vertically about 1 centimeter lateral to the sternum, and it runs posterior to the costal cartilages and anterior to the pleura. It terminates in the 6th costal space, divides into the superior epigastric artery and the musculophrenic artery. So branches, we have the anterior intercostal arteries. Okay, this is what anterior intercostal arteries, I saying it. We have the what perforating branches. Those ones, they supply the skin and the breast. We mostly see it when basically everything is there. Then we have the pericardiophrenic artery. We'll elaborate more of them when we start talking about thorax anatomy. So terminal branches, we have the superior epigastric artery, then we have the what musculophrenic artery. So this is what internal thoracic or the internal mammary artery. So supplies the anterior thoracic wall, supplies the breast tissues, supplies the pericardium and the diaphragm, supplies the anterior abdominal wall. So it's very important in what coronary artery bypass surgeries. It's very important in breast surgeries. It's very important to know about the collateral blood supply that is around the chest. Okay, and you should know that it's very important in imaging too.